Instructions to administer the medication. Daily Decapeptyl Bolus, 2 vials. Before administering the medication, read the following instructions carefully. Wash your hands properly before preparing and administering the medication. Try and choose somewhere clean and peaceful to prepare the medication. Make sure you have all the necessary material ready for the injection. At your pharmacy, you must get alcohol, medical gauze, and a suitable container to dispose of the material after using it. The medication that is kept in the refrigerator must be taken out 5 minutes before using it, so that it is at room temperature at the time of the injection. To improve the effect, try and administer the medication at approximately the same time every day, preferably at midday. Don't worry if there is a minor local reaction, such as redness, itching or pain in the injection site. That is normal due to the effect of some of the drugs used. If it lasts more than 24 hours, seek help at your UR group clinic. Once the medication has been administered, dispose of the material used in the container. If you have any questions, you should get in touch with your UR group clinic. The method to prepare and administer your medication is as follows. The Daily Decapeptyl pack contains 7 powder vials, 7 solvent vials. You will have previously collected your syringes and intramuscular and subcutaneous needles from your UR group clinic. Take a solvent vial and 2 powder vials to prepare a 0.2 mg Decapeptyl Bolus. Prepare a syringe, an intramuscular needle and a subcutaneous needle. Using the gauze, open the solvent vial, pointing it towards you and pulling it back. Remove the yellow plastic top from the 2 powder vials. Insert the intramuscular needle into the syringe and extract all the liquid from the solvent vial by pulling back on the plunger. Vertically place one of the powder vials on the preparation surface. Insert the needle in the center of the rubber cover of the powder vial. Slowly push the syringe plunger in order for the liquid to be inserted into the powder vial, attempting to create a flow along its wall to prevent bubbles forming. Do not shake the vial. Without releasing the plunger or removing the needle, roll it with your fingers until the powder is completely diluted. This will prevent bubbles forming. Once dissolved, extract the solution in the syringe, placing the end of the needle at the bottom of the vial and tipping it slightly. Do not release the plunger until the needle is fully removed in order for the liquid not to go back into the needle. With the same syringe and needle, insert in the rubber top of the second powder vial and slowly insert the solution obtained from the first vial. Mix and remove in the same fashion as the first vial. Change the syringe's intramuscular needle for the subcutaneous needle. With the needle pointing upwards, tap the syringe a few times to concentrate the air bubbles and to remove them easily by slowly pressing on the plunger until a small drop appears on the needle. The medication should be used immediately after preparation. Injection in the abdomen. The medication must be administered in the anterior area of the abdomen, about 3 fingers away from the navel. The injection site must be changed every day to improve absorption and to avoid any possible discomfort. Clean the injection site with medical gauze soaked in alcohol. Pinch the skin with one hand. Insert the needle completely, holding the bevel upwards at an angle of between 45 and 90 degrees to the skin. Inject the whole dose, pressing down on the plunger of the syringe slowly and constantly until it is empty. Wait for 5 seconds. First let go of the skin and then gently remove the needle. Apply pressure on the injection site with medical gauze for a few seconds and gently massage the area. This will favour the dispersal of the medication under the skin. If you have a suitable disposal container, put the used needles in it without putting the caps on them. If you don't have a suitable container, put the caps back on the needles, being very careful not to prick your fingers, and keep them somewhere safe until you can take them to a UR group clinic, where we will be able to dispose of them for you. Remember that you must not reuse the needles or share them with anyone else. Keep the Daily Decapeptyl in a dry place at room temperature that does not exceed 25 degrees Celsius and in its original packaging, protected from direct sunlight.